Good morning all. Today we shall discuss about normal periodontium. Periodontium is the supporting apparatus for the teeth in function and in occlusal relationship. It consists of gingiva, periodontal ligaments, cementum, and the alveolar bone. In the maintenance of the teeth in the oral cavity, the health of the periodontium as a whole is of paramount importance. Now we will discuss briefly about each component of normal periodontium. First is the gingiva. Gingiva is the part of oral mucosa that covers the alveolar process and surrounds the cervical portion of the teeth. It may be divided into three zones: papillary or the interdental papillae, marginal gingiva or free gingival margin, and the attached gingiva. Here in this picture, we can see the components of gingiva, marginal gingiva, interdental papillae, and the attached gingiva. Here, this picture is a cross-sectional view of the histological representation of the gingiva, showing the marginal gingiva and attached gingiva. Now, we'll discuss about the marginal gingiva. The marginal gingiva consists of gingival sulcus and a free gingival margin. The free gingival margin in primary dentition is found to be thicker and rounder compared to the permanent dentition, which is knife-edged. The free gingival margin of primary dentition is thicker and rounder because as the primary tooth is having a short bulbous crown with a cervical bulge and a constriction at the CEJ, this gingival margin of the primary dentition appears more thicker and rounder. It is also found that free gingival margin of primary dentition is flaccid and retractable. This may be due to the presence of immature connective tissue and immature gingival fiber system. Now about the gingival sulcus, the sulcus depth in permanent dentition it is 2 to 3 mm. Whereas in the primary dentition, it is comparatively greater, and it is found that the sulcus depth in the primary dentition ranges from 1.4 mm to 2.1 mm. Now coming to the attached gingiva. The width of the attached gingiva in primary dentition is comparatively greater than that found in the adult dentition. Another difference seen in the primary dentition compared to that found in the permanent dentition is that the gingiva or the attached gingiva appears less dense and redder. This may be due to three factors. First of all, it is because of the fact that the epithelium of primary dentition is more thinner than the permanent dentition. Also, it is less keratinized. And also it is found that the primary dentition epithelium shows greater vascularity than that of permanent dentition. Because of these three factors, the primary dentition attached gingiva appears less denser and more redder. Now coming to another finding which is seen in the attached gingiva, that is the stippling. The epithelial surface of this attached gingiva has many irregularities. This irregularities is known as stippling. Actually, stippling is an adaptive specialization to bear the masticatory forces, and it is a common feature seen in adult gingiva, and this stippling represents a healthy gingiva. And loss of stippling is a common sign of any gingival disease. Coming to the attached gingiva of primary dentition, the texture of the attached gingiva is less stippled and it is absent during infancy, and usually the stippling starts to be evident by 2 to 3 years of age, and the incidence of stippling, that is the presence of stippling, is seen in 35% of children either at an age group of 5 to 15 years. Another two unique anatomic characteristics that are found in the attached gingiva is Attached gingiva of children is interdental cleft and retrocuspid papillae. This is the figure showing the interdental cleft. What is an interdental cleft? It is a normal anatomic feature found in the interradicular zone, that is lying almost underlying the interdental saddle areas. Another feature is the retrocuspid papillae. It is a circumscribed round to oval 2 to 4 mm nodule that lies lingual to the mandibular cuspid. Here in this picture, we can see a retrocuspid papillae seen behind the mandibular cuspid, or lingual to the mandibular cuspid. Now, moving on to papillary gingiva or interdental papillae. Interdental papillae is that part of gingiva that present beneath the contact area of the tooth, and it occupies the gingival abrasion. The interdental gingiva or the interdental papillae can be pyramidal or cone-shaped in adult dentition or the permanent dentition. Because of this, its location and morphology and lack of keratinization of this epithelium in the caul area, this area is more vulnerable to bacterial growth and secondary tissue invasion. Whereas in primary dentition, there is lack of interproximal contact. So there will be fusion of papillae and they form interdental saddle areas instead of caul areas. And this saddle areas are well keratinized, whereas the caul unlike caul area, which is less keratinized, this saddle area is well keratinized. So that this is the reason for the lesser prevalence of periodontal lesions in children. Now let's summarize the difference between the periodontium of adult and primary dentition, or the primary teeth and the permanent teeth. First, regarding the marginal gingiva. Marginal gingiva, as we said, it has two components, gingival sulcus and free gingival margin. Gingival sulcus depth is more in primary teeth than permanent teeth. The gingival margin is thicker and rounder in primary teeth, whereas in permanent teeth it is knife edge, and also the free gingival margin is more retractable and flaccid. Next, attached gingiva. Attached gingiva is less keratinized, less dense, and it shows increased vascularity in case of primary tooth, whereas in permanent tooth, the attached gingiva is more keratinized, more dense, and less vascular. In primary dentition, attached gingiva shows less stippling, and it shows two unique characteristics like interdental cleft and retrocuspid papillae, which is absent in permanent teeth. Coming to the papillary gingiva shows interdental saddle areas in primary teeth, and in permanent teeth, it is interdental caul area. This interdental saddle area is keratinized, so that there is less bacterial invasion and the prevalence of periodontal diseases is less common in children because of that reason. Now coming to the difference in the periodontal ligament in primary and permanent teeth, the periodontal ligament space is more wider in primary teeth compared to that of the permanent teeth, but it is less fibrous and more vascular. Alveolar mucosa in primary teeth, it is redder, whereas it is less redder or darker in case of permanent teeth. So to the alveolar bone of primary teeth is less calcified, more vascular, and with fewer and thick trabeculae. Also, it shows large marrow spaces and thin lamina dura, and also flat interdental crest. Coming to the cementum, the primary teeth or the cementum of the primary teeth is thinner compared to that of the permanent teeth. We shall discuss the gingival diseases in children in the next class. This is all about normal periodontium in primary dentition. Thank you.